Study about the urinary tract infections and hematuria. So UTI is very common, especially women older than 15 years of age. And greater risk is in pregnant people and elderly people. What is asymptomatic bacteriuria? So we do not treat asymptomatic bacteriuria in women of childbearing age with normal physiology, but we need to treat it in pregnant patients. What is ASB? The presence of more than 1 lakh colony forming unit per ml of a single pathogen on 2 successive clean catch urine in a woman without symptom. What is asymptomatic bacteriuria in a man or a woman? So presence of more than 1 lakh CFU per ml of single pathogen in 2 successive clean catch midstream urine, or more than 1 lakh CFU per ml on 1 clean catch stream urine in men. So women में 2 samples चाहिए, men में 1 sample चाहिए, और the presence of 100 CFU per ml in a single isolate in a catheterized urine specimen in a patient without symptom. So अगर Foley's लगाए, even 100 is bacteriuria. Infections of lower urinary tract are urethritis and cystitis. So cystitis से ऊपर, bladder से ऊपर, those are upper UTI. Just like that, pyelonephritis is an infection of the upper urinary tract. What is uncomplicated UTI? Uncomplicated UTI is a UTI in a patient without structural or functional abnormalities within the urinary tract or kidney parenchyma. So there will be normal anatomy and normal function. Then without any comorbidities that place the patient at risk for more severe adverse outcome, and no genitourinary instrumentation. So this just defines that a UTI in a structurally, functionally normal, young, healthy, non-pregnant woman will be uncomplicated UTI. Young, healthy, non-pregnant women with normal anatomic and functioning urinary tract without any Foley's in place will be uncomplicated UTI. Rest all UTI will be complicated UTI. What is complicated UTI? It is infection involving a functional or anatomically abnormal urinary tract or infection in the presence of comorbidities. So complicated UTI is infection involving a functional or anatomically abnormal urinary tract or infection in the presence of comorbidities that place the patient at risk for more severe adverse outcomes. Just like UTI in a man, UTI in a catheterized patient, recurrent UTI, advanced age, neonates, pregnants, comorbidity, immunosuppression, atypical agents, neurological disease. What is recurrent UTI and relapse of UTI? So relapse of UTI is recurrence of UTI within 2 weeks of treatment completion. यानी आपने आज ट्रीटमेंट बंद किया एंड बंद करने के 2 हफ्ते में पेशेंट को फिर से यूटीआई हो गया, वो भी सेम ऑर्गेनिज्म से. Within 2 weeks of treatment completion caused by the same organism is relapse. Reinfection is a recurrent UTI caused by different organism. So reinfection is different organism. What is urethritis? In male, dysuria with a urethral discharge indicates urethritis. What are the etiologies and different types of UTI? So uncomplicated UTI is E. coli. Basically any UTI is most commonly caused by E. coli. then the second position varies. So in uncomplicated UTI, it will be staph, Klebsiella and Enterococcus. We see a lot of Klebsiella UTI in our ICU. So staph, Klebsiella, Enterococcus. Staph saprophyticus is seen on skin also. Staph saprophyticus is found in genitourinary tract like your perineum, vagina. The complicated UTI will be due to Enterococcus, Klebsiella, staph, Proteus, Pseudomonas, and fungus like Candida. Then COTY, catheter-related UTI, can be Enterococcus, your coagulase negative staph, then Candida, Pseudomonas, Proteus, Morganella. In a woman, a history of vaginal discharge or irritation is more associated with vaginitis, cervicitis or PID rather than UTI. What is pyelonephritis? It is caused by flank pain. There will be flank pain, costovertebral angle tenderness, because उसी एंगल पे किडनी रहती है between the ribs and the vertebra. Or specific renal tenderness to deep palpation may be associated with cystitis because of referred pain. So pyelonephritis is flank pain, costovertebral angle tenderness, and fever, chills, nausea, vomiting, prostration. Prostration क्या होता है? पेशेंट को झुकेगा जब, पेशेंट विल प्रे, लाइक एकदम झुक के प्रे करना, उसमें उसको आराम मिलेगा.